drawMD Cardiology is an application designed by Visible Health Incorporated, allowing providers the ability to digitally synthesize and illustrate diverse anatomies, pathologies, and medical devices on the handheld iPad platform. This application allows practitioners the ability to provide visual reference for educational purposes. Imagine having the ability to sit down with a patient and draw step-by-step details which allow them to have a visual understanding of the procedure for which they are about to sign consent. The period after the procedure is an extremely nervous time for patients and family as well. Using drawMD, providers can quickly provide detailed illustrations of the end result of the procedure. Many practitioners specialize in fields outside of cardiology or are students who have limited knowledge of the field. Nursing professors can use this tool to illustrate to their students procedures for which their patients have or are soon to undergo, as well as the disease processes which made them necessary. Many nurses belong to specialized fields. This application also allows nurses who have been in other fields other than cardiology to visually remediate cardiac anatomy, disease processes, and procedures for which aids them to better collaborate with physicians and patients. The figure on the left began with a simple depiction of the heart. From there, the user opened the stamp tool, which had a preloaded image of a pacemaker. They resized this image, fitted over the heart, and overlaid the stamp onto the heart. Once this was in place, they selected the pen tool and drew arrows and lines showing conduction of electrical signals throughout the heart. Finally, text was placed on the template indicating the procedure and the date it was performed. The figure on the right was performed in a similar manner. The provider had a template of the exterior of the heart in order to show prior placement of a stent and the disease process which took place since the placement, and the possibilities indicating need for further intervention. drawMD Cardiology offers tools which allow students and professors to systematically visualize each system while analyzing patient data in order to either incorporate or eliminate physiological possibilities and diagnoses within their plan. The subscriber who created the illustration at the top of the screen incorporated drawMD Cardiology into the assessment process to provide a visualization of the possible causes for patient chest pain. This application can be used by nurse educators to provide information about the latest cardiac devices, providing the nurse with a clear understanding of the device and how it works. The picture at the bottom of the slide shows an example of a ventricular assist device and how it was placed within the anatomy. This is only one of many stamps which are contained or may be integrated into the drawMD Cardiology platform. Perhaps one of the best features of this app is its simplicity. The provider can quickly link to iTunes and download the application in only a few minutes. Available from the home screen is an information tab which provides detailed instructions on how to get started using the application, as well as links to technical support. Drawings are created in layers, allowing the provider to quickly and easily access specific aspects of their drawing and edit them without affecting other layers. A drawing can be either saved to the device, printed, or shared via email. Once the practitioner provides a patient with any kind of data, especially printed or electronic, that person is responsible for the accuracy of the information provided. Therefore, depictions rendered in drawMD Cardiology could potentially be used as evidence should a legal situation arise. Drawings created within drawMD Cardiology are subject to HIPAA and must be kept confidential. Any printed materials would need to have patient identifiers removed and disposed of properly. Any device which may contain patient information would need to be password protected. Information shared via email must be password protected on the receiving end to ensure that only the intended receiver is viewing the materials. This application is extremely versatile since it's available on the iPad format, which can be carried virtually anywhere. However, this fact and the fact that it is only available for the iPad limits its uses as well, considering the diversity of tablets available on the market today. Another great benefit to this application is that it's free, considering its capabilities and usefulness within the nursing profession. drawMD Cardiology can be useful in diverse settings such as classrooms, private practice, hospitals, and home healthcare settings. It is a simplistic layout which provides the practitioner with a quick, easy-to-use device, providing realistic yet understandable depictions of anatomy, pathologies, medical devices, and procedures. Given these factors, this device will be highly recommended for any provider seeking to enhance their abilities to provide precise, easy to understand educational information.